You are doing everything right to control your sugar. The careful meals, the daily walk, the pills exactly as prescribed, and the number on your meter still will not come down. Before you blame yourself, I want you to look somewhere almost no one thinks to check: your own medicine cabinet. Several of the most common medications prescribed to seniors, drugs taken by millions of people for completely unrelated problems, can quietly push your blood sugar up while you fight to bring it down. Most people have no idea this is happening, and most doctors never mention it in a rushed 15-minute visit because the drug is doing what it was prescribed to do, just with a side effect nobody warned you about. Stay with me, because number 4 on this list is one that is handed out so routinely that nearly every person over 60 has taken it at some point, and almost no one connects it to rising blood sugar. Before we begin, do me a quick favor. If you would rather understand your own body than just be handed another pill, hit subscribe, give this a like, and tell me in the comments how old you are and which of these medications you take. I read every single one, and the answers shape what I cover next. Before I walk you through the 7 medications, I need to explain how a drug that has nothing to do with diabetes can raise your blood sugar. Because once you understand the mechanisms, every medication on this list will make complete sense. Your blood sugar is controlled by a careful balance between insulin, the hormone that pulls sugar out of the blood and into the cells, and several counter-regulatory hormones that push sugar up, like cortisol, glucagon, and adrenaline. A drug can raise your blood sugar in several ways. It can stimulate your liver to dump stored sugar into the bloodstream. It can make your cells more resistant to insulin, so they stop listening to the signal. It can damage or exhaust the beta cells in your pancreas that produce insulin. Or it can interfere with the way your kidneys handle glucose. Most of the medications on this list do one or more of these things, and the effect can be subtle enough that you do not notice it happening until your A1C has crept up, and your doctor is reaching for the prescription pad to add a diabetes drug on top of the drug that caused the problem in the first place. That is the cycle I want to help you break, and breaking it starts with knowing which drugs to watch. And let me be absolutely clear about something before we go any further. I am not here to tell you to stop any medication. Many of the drugs on this list save lives, and stopping them abruptly can be dangerous. What I am here to do is help you understand what is happening inside your body so you can walk into your next appointment armed with the right questions and work with your doctor to find the best path forward, whether that is switching to an alternative, adjusting a dose, or simply monitoring your blood sugar more closely. Knowledge is not rebellion, it is partnership. My name is Dr. Angela Way, and after more than 15 years of practice, I have watched this pattern play out hundreds of times. A patient's blood sugar starts rising, everyone assumes the diabetes is getting worse, another drug gets added, and nobody stops to ask whether the answer was already sitting in the medicine cabinet. 7 medications. Let me show you. Number 1 is corticosteroids. And these are the single most powerful blood sugar-raising medications in common use. I am talking about drugs like prednisone, prednisolone, dexamethasone, and methylprednisolone, the pills, the injections, and even the longer courses of inhaled steroids that are prescribed for asthma. Corticosteroids are given for a huge range of conditions: arthritis flare-ups, severe allergies, autoimmune diseases, breathing problems, skin conditions, joint pain, and dozens of others. Seniors receive them constantly, whether it is a short burst of prednisone for a bad chest infection or a cortisone shot in a painful knee. Here is what they do to your blood sugar. Corticosteroids mimic cortisol, your body's own stress hormone. And when cortisol levels go up, 2 things happen. First, your liver starts pouring stored glucose into the bloodstream because your body thinks it is under stress and needs fuel. Second, your muscle and fat cells become markedly more resistant to insulin. So even though your pancreas is pumping out insulin to deal with the flood, the cells are not listening. The result is a sharp rise in blood sugar that can begin within hours of the first dose. In people who are already pre-diabetic or diabetic, Even a 5-day course of prednisone can send fasting blood sugar into the 200s and push A1C up noticeably. The effect is dose-dependent. The higher the dose and the longer the course, the worse the impact. Even a single cortisone injection into a knee or shoulder can raise blood sugar for days to weeks afterward. And I cannot tell you how many patients have come to me panicked after a routine knee injection sent their fasting numbers soaring to 240 for a week. They assumed their diabetes had suddenly gotten worse, when in reality, the steroid was simply doing what steroids do. Once the injection wore off, their numbers came back down on their own. What to do? If your doctor prescribes a corticosteroid, ask how long the course will be. Ask about the lowest effective dose, and ask whether a non-steroidal alternative exists for your condition. Monitor your blood sugar more frequently during and after the course, and let your diabetes doctor know so they can adjust your diabetes medication temporarily if needed. Never stop a prescribed steroid abruptly because your body can go into a dangerous withdrawal if the dose is not tapered properly. Number 2 is thiazide diuretics, and these are among the most commonly prescribed blood pressure medications in the world. Hydrochlorothiazide, chlorthalidone, and indapamide are the names you will see on the bottle. They are often the first drug a doctor reaches for when your blood pressure is too high because they are cheap, effective, and well-studied. They work by making your kidneys excrete more sodium and water, which reduces blood volume and lowers pressure. But thiazides have a well-documented side effect on blood sugar, and it works through an unexpected door. Thiazides cause your kidneys to excrete more potassium along with the sodium, and low potassium levels impair the ability of your beta cells to release insulin properly. Less insulin means more sugar sitting in the blood. On top of that, thiazides appear to directly increase insulin resistance in muscle cells, making the insulin you do produce less effective. The impact is usually modest, a rise of 5 to 15 milligrams per deciliter in fasting glucose. But in someone who is already on the edge between prediabetes and diabetes, that modest rise can be the push that tips them over the diagnostic line. And because thiazides are often taken for years or even decades, the effect compounds quietly. What to do? Ask your doctor to check your potassium level at your next blood draw. If it is low, a potassium supplement or a potassium-sparing diuretic may help. If your blood sugar has been climbing since you started a thiazide, ask your doctor whether an ACE inhibitor or an ARB might be a better blood pressure option for you, because those classes do not raise blood sugar and some actually improve insulin sensitivity slightly. Do not stop the thiazide on your own, because uncontrolled blood pressure is far more dangerous than a modest rise in blood sugar. Number 3 is beta blockers, and these are another extremely common class of blood pressure and heart medication. Metoprolol, atenolol, and propranolol are the names you will see most often. Beta blockers work by slowing your heart rate and reducing the force of each heartbeat, which lowers blood pressure and protects the heart. But they also block some of the signals that help your pancreas release insulin in response to rising blood sugar, which means your body is slower to clear glucose after meals. On top of that, beta blockers can reduce blood flow to the muscles, which are the primary destination for glucose after insulin does its work. So even the insulin that is released has a harder time getting sugar into the cells where it belongs. The older, non-selective beta blockers like propranolol and atenolol have the strongest blood sugar-raising effect. The newer, selective ones like carvedilol and nebivolol are gentler on blood sugar and may even have some favorable metabolic effects. There is one more thing about beta blockers that is especially important if you take diabetes medication. They can mask the symptoms of low blood sugar. Normally, when your blood sugar drops too low, you feel your heart race, you feel shaky, you sweat. Those are the warning signs that tell you to eat something immediately. Beta blockers suppress those warning signs, so you might not realize your blood sugar has dropped dangerously low until you are dizzy, confused, or about to pass out. What to do? If you take a beta blocker and your blood sugar has been creeping up, Ask your doctor whether you are on one of the older types and whether a newer, more metabolically friendly beta blocker like carvedilol or nebivolol might work for your condition. And if you also take insulin or a sulfonylurea, be extra vigilant about checking your blood sugar regularly, because you cannot rely on the usual warning symptoms to tell you when you are going low. Number 4 is statins, and this is the one I warned you about at the beginning. Statins are the most widely prescribed class of medication in the developed world. Atorvastatin, rosuvastatin, simvastatin, pravastatin, and lovastatin are the common names. They are prescribed to lower LDL cholesterol and reduce the risk of heart attack and stroke, and they are extraordinarily good at that job. Tens of millions of seniors take a statin every single day. But in 2012, the FDA added a warning to all statin labels, acknowledging that they can increase blood sugar and A1C. The mechanism is not fully understood, but research suggests that statins may reduce insulin secretion from the beta cells, increase insulin resistance in muscle and fat cells, and interfere with glucose uptake into cells through a pathway involving a transporter called GLUT4. A large meta-analysis published in The Lancet found that statin therapy was associated with a 9% increased risk of developing new-onset diabetes. For people who already have diabetes or prediabetes, the effect can show up as a rise in A1C of roughly 0.1 to 0.3%, which is enough to push someone across a diagnostic threshold or prompt a doctor to increase diabetes medication. What makes this one so tricky is the sheer number of people affected. If 9% of statin users develop higher blood sugar, and tens of millions of people take statins, that is, millions of people whose blood sugar is being pushed up by a drug they take for their heart, not their metabolism. In my own practice, I have seen patients spend months adjusting their diet and exercise, feeling like failures because their A1C would not budge, only to discover that the statin they started around the same time was the hidden variable. Now, here is the important nuance. For most people at high cardiovascular risk, the heart protection statins provide outweighs the blood sugar effect by a wide margin. You should not stop your statin because of this information, but you should know it is happening, and you should ask your doctor to monitor your blood sugar and A1C regularly while you take it. If your blood sugar has risen since starting a statin, it may not be your diet getting worse. It may be the drug. Knowing that can save you from unnecessary guilt and from adding a diabetes medication you might not need if the statin dose or type were adjusted. What to do? Ask your doctor whether your current statin is the best choice for your metabolic profile. Pravastatin and pitavastatin appear to have the smallest effect on blood sugar. And make sure your A1C is being checked at least twice a year while you are on any statin. Number 5 is certain antipsychotic and psychiatric medications. And this is a category that catches people by surprise because they do not think of mood or sleep medications as having anything to do with blood sugar. But several drugs commonly prescribed for mental health conditions and sometimes prescribed off-label for insomnia or agitation in seniors can have a significant effect on glucose metabolism. The atypical antipsychotics are the main concern. Olanzapine and clozapine have the strongest association with weight gain, insulin resistance, and new-onset diabetes. Quetiapine and risperidone fall in the middle. These drugs can cause weight gain, especially around the abdomen, which increases insulin resistance directly. They also appear to affect the beta cells and alter the way the brain regulates appetite and glucose production. Even at the low doses sometimes prescribed to seniors for sleep or anxiety, the metabolic effect can be real and cumulative over months. Some older antidepressants, particularly the tricyclics like amitriptyline and nortriptyline, can also raise blood sugar through weight gain and metabolic changes, though the effect is generally milder. What to do? If you take any psychiatric medication, ask your doctor to include fasting glucose and A1C in your regular blood work. If your blood sugar has been rising since starting one of these medications, ask whether an alternative with a lower metabolic risk exists for your condition. And if you were prescribed quetiapine or olanzapine specifically for sleep, ask whether a non-antipsychotic sleep option might work just as well without the blood sugar consequences. This is not about choosing between mental health and blood sugar. It is about making sure your doctor knows you are watching both, because the solution is often a simple switch to a medication with fewer metabolic side effects, not a choice between your mind and your meter. Number 6 is niacin, also known as nicotinic acid or vitamin B3. And this one surprises people because it is sold as a supplement, which makes it feel harmless. Niacin has been used for decades to raise HDL cholesterol, the so-called good cholesterol, and to lower triglycerides. Many seniors either take prescription-strength niacin or buy it over the counter on their own because they read that it helps cholesterol. The problem is that niacin, especially at the higher doses used for cholesterol, increases insulin resistance and stimulates the liver to produce more glucose. The blood sugar-raising effect is dose-dependent and well-documented. A study in the Archives of Internal Medicine found that niacin therapy was associated with a significant increase in fasting glucose and a higher rate of new-onset diabetes. The extended-release form of niacin, which was developed to reduce the notorious flushing side effect, still raises blood sugar, and some research suggests it may be even harder on glucose metabolism than the immediate-release form. What to do? If you are taking niacin for cholesterol, either by prescription or on your own, tell your doctor and ask them to check your fasting glucose and A1C. If your blood sugar has been climbing, ask whether the benefit of niacin on your cholesterol is worth the cost to your blood sugar, especially now that other medications like statins and fibrates can do much of the same work without raising glucose. And if you are taking over-the-counter niacin supplements at high doses without a doctor's guidance, please stop and discuss it with your doctor first. Supplement does not mean safe at every dose. Number 7 is fluoroquinolone antibiotics, and I saved this one for last because it is the most unpredictable and the least well-known. Ciprofloxacin, levofloxacin, and moxifloxacin are the common names, often known by their brand names Cipro, Levaquin, and Avelox. These are powerful antibiotics prescribed for urinary tract infections, respiratory infections, sinus infections, and a variety of other bacterial infections. Seniors receive them frequently. The effect of fluoroquinolones on blood sugar is unusual because it can go in both directions. They can cause dangerously high blood sugar or dangerously low blood sugar, sometimes in the same patient within the same course of treatment. The mechanism involves direct effects on the beta cells of the pancreas. Fluoroquinolones appear to stimulate insulin release unpredictably, which can cause a sudden drop in blood sugar and then rebound with insulin resistance and hyperglycemia. The risk is highest in people who are already taking diabetes medications, especially insulin or sulfonylureas, because the combination can amplify the swings. The FDA has issued multiple warnings about fluoroquinolone-associated blood sugar disturbances, and the effect can be severe enough to land people in the emergency room with hypoglycemia they did not see coming. What to do? If you are prescribed a fluoroquinolone antibiotic and you have diabetes or prediabetes, tell the prescribing doctor about your blood sugar condition if they do not already know. Check your blood sugar more frequently during the entire course of the antibiotic and for several days after you finish it. Watch for symptoms of low blood sugar, dizziness, confusion, shakiness, sweating, especially in the hours after a dose. And ask your doctor whether a different antibiotic could treat your infection without the blood sugar risk, because for many common infections, safer alternatives exist. Before I give you the plan, let me tell you about a patient I will call Robert. 71 years old, retired postal worker, and one of the most disciplined people I have ever worked with. Robert had been diagnosed with type 2 diabetes 5 years earlier and had been managing it carefully with metformin, daily walks, and a sensible diet. His A1C had held steady around 6.8 for 2 years, and he was proud of that. Then, over the course of about 6 months, his numbers started climbing for no apparent reason. His fasting blood sugar went from the 120s to the 140s, and his A1C crept up to 7.3 at his next check. His doctor told him the diabetes was progressing and that they should add a second medication. Robert did not accept that without asking questions, and that is the thing that changed everything. When we looked at his full medication list together, we found that in the past year, his cardiologist had started him on atenolol for a mild heart rhythm issue. His primary care doctor had added hydrochlorothiazide to get his blood pressure under control, and Robert himself had started taking high-dose niacin from the health food store because he read an article about raising his HDL cholesterol. 3 blood sugar-raising medications layered on top of each other, none of them prescribed for anything related to diabetes, and nobody had connected the dots. Working with his doctors, Robert switched from atenolol to a newer beta blocker that was gentler on blood sugar. His blood pressure medication was changed from the thiazide to an ACE inhibitor, and he stopped the over-the-counter niacin entirely after his doctor explained that his statin was already handling his cholesterol. Within 2 months, his fasting blood sugar dropped back into the 120s. At his next A1C check, he was back down to 6.9, and 3 months after that, he was at 6.7, right back where he had been before the climb started. He never needed the second diabetes medication. The answer had been in his medicine cabinet the entire time. And here is the detail that matters most. Robert had not changed a single thing about his diet or his exercise during those 6 months of climbing numbers. The food was the same, the walks were the same, the only things that had changed were the other medications, and once those were adjusted, the blood sugar came right back down. His discipline had been working the entire time. It just could not outrun 3 drugs pulling in the opposite direction. What stayed with me about Robert is what he said at that follow-up. He told me he had spent 6 months believing his body was betraying him, that all the discipline and walking and careful eating had stopped working, and there was nothing he could do about it. When he found out it was the medications, not his willpower, he felt a wave of relief he was not expecting. He said it was like being accused of something he did not do and finally being cleared. I have watched that same relief cross the faces of more patients than I can count. So let me tie all 7 of these together and give you the pattern to watch for. Your blood sugar is controlled by a balance between insulin on one side and everything that pushes sugar up on the other. Corticosteroids flood your bloodstream with glucose and make your cells deaf to insulin, a double hit. Thiazide diuretics drain your potassium and weaken your beta cells. Beta blockers slow your insulin response and mask the warning signs of lows. Statins interfere with insulin secretion and glucose uptake at the cellular level. Certain psychiatric medications drive weight gain and insulin resistance. Niacin stimulates your liver to overproduce glucose, and Fluoroquinolone antibiotics shake your pancreas in unpredictable directions. Any one of these alone might nudge your blood sugar up modestly, but seniors often take 2, 3, or even 4 of them at the same time, and the effects stack. That quiet stacking is why your blood sugar may be climbing even when you are doing everything right with your food and your exercise. Let me draw one clear and firm line before I give you the plan. Do not stop any medication after watching this video. Every drug on this list was prescribed for a reason, and stopping some of them abruptly, especially corticosteroids and beta blockers, can be medically dangerous. This information is not a reason to rebel. It is a reason to have a better conversation with your doctor. The goal is not to throw away medications. The goal is to make sure the full picture is on the table so that you and your doctor can find the combination that protects your heart, your blood pressure, your cholesterol, your joints, and your blood sugar at the same time, instead of fixing one problem while quietly creating another. And here is a practical tip for that doctor's appointment. Most office visits are short, and your doctor is juggling multiple concerns, so do not wait for them to bring this up. Print out your medication list or write it clearly on a piece of paper. Next to each medication that matches this list, write the words Can this raise my blood sugar? Handing your doctor a written list with specific, focused questions is 10 times more effective than trying to remember everything in the moment. It turns a rushed visit into a productive one, and most doctors genuinely appreciate a patient who comes in prepared rather than passive. Here is what to do this week. 5 steps. 1. Open your medicine cabinet tonight and write down every medication you take, including any over-the-counter supplements like niacin. 2. Compare that list to the 7 medications we covered. Circle any that match. 3. At your next doctor's appointment, bring the list and ask this exact question. Could any of my current medications be contributing to my rising blood sugar? 4. Ask your doctor to check your A1C and fasting glucose at the same visit so you have a current baseline. 5. If any of the medications on this list match yours, ask your doctor whether a blood sugar-friendly alternative exists for that condition, because in many cases it does. You are not powerless in this. You are not failing. And you may be closer to good blood sugar control than you think, once the hidden drag from your medicine cabinet is identified and addressed. The patients who improve the fastest are not the ones who do the most dramatic thing. They are the ones who ask the right question. And now you know exactly what that question is. Now, everything we covered today is about what might be pushing your blood sugar up from the outside. But there is another side to this equation, the foods that actively pull your blood sugar down from the inside. I made a video that walks you through the best foods to eat to lower your blood sugar naturally and quickly, explaining exactly how each one works. I will put it right here on the screen. Before you go, tell me in the comments which of these 7 medications you take, because your answers help me decide what to cover next. Go watch that one now, and I will see you there.